All right, a little bit about the Center for Survey Research. So we have been around since the early 1980s. We actually were started by a couple of social science faculty members on the Bloomington campus as a place to provide the opportunity for faculty to do telephone survey research. We've grown a lot since those early days. So hopefully you'll see the kind of the breadth has changed, and the scope of collaborators that we work with has definitely changed a lot too over time. We are also a founding member of the Association of Academic Survey Research Organizations. This is a professional association of survey centers that are located in academic settings, the leading association for that. Let's see here. We also are a unit of IU's research office, so are part of the research infrastructure at IU, not part of a particular school or department. So as Jill mentioned, I'm a faculty member in the O'Neill School, but our center actually sits within the research office. So we serve faculty all over campus, all different schools and departments. And as you can imagine, over these many years, have had the opportunity and privilege of working with faculty, staff, students to conduct thousands of different types of projects across a variety of substantive areas, from health and medicine to social sciences, to education, to business. So really running the spectrum of projects with an increasing focus, I would say, in recent years on health and medicine. And our involvement can take a variety of different forms. So hopefully you'll see this as we're going through the presentation. We really pride ourselves on being very flexible and trying to meet our faculty with the needs that they need for their particular project. Sometimes this means expanding into new areas. So as I said, when we started, we were just really doing a lot of telephone surveys, but now do surveys across a variety of different methods, and also collect data using medical specimens and environmental samples, and also qualitative research too as well. So really the spectrum kind of that you could imagine in terms of collecting data from humans and making our survey center really adaptable to changes in how people have collected data over time. A challenge that we have is that people certainly see survey research in our name, but we do a lot more than surveys. If you're looking to do qualitative research, so focus groups or qualitative interviews or direct observations of people using some standardized form, those are also services that we're able to provide. As I mentioned, collecting medical specimens or environmental samples, so dust, tap water, urine, saliva, blood, all are all capacities that we have at our center too as well, from a very experienced field staff team. And even things like programming and interface. So over the years of the development of our center, we've got a really experienced technical team that is able to program, do high-level programming of interfaces. So even if you need to have someone, say, go to a website and upload a file for a project that you're doing, maybe you want people to go to a website and download something, even just programming an interface that might not even have something to do with a survey is something that we bring. We certainly have developed that through a variety of different research projects that we've been involved in. So a strong IT team is certainly something that I lean on a lot at our center. And our goal really is to work with you to ensure that you've got a strong design and it's done using as cost-effective as an approach as possible. So I really view our job to make your life easier. I really want to make sure that you bring the substantive expertise and we can help bring the methodological expertise so you can focus on your research question, and we can handle a lot of the operational details that oftentimes can take time and money to do. We can do that in a very cost-effective way, and also with the latest survey science. So we're constantly attending conferences, developing our staff professionally, bringing in experts to be able to ensure that we're doing really methodologically rigorous work. That's a really important part of our mission as an academic survey center. All right, I wanted to go through 3 different main areas of core services that we offer. So we'll go through each of these in turn. And the first area will be research design and development. So thinking about things like the sample design or developing a questionnaire, or even just what is your overall research design. So sometimes people will come to us and they have a sense of what they want to measure, but maybe you're thinking about, is it better that I use some qualitative research technique like focus groups or interviews? Or is it better that I should be thinking about a survey? Do I need a combination of both? What kind of survey should I do? Should I do something by mail or web? Those are all things in the research design phase that we're happy to assist with and can bring our methodological expertise to that. And then, as I mentioned, sample design, questionnaire design, developing the IT infrastructure you would need for your project, programming any instruments or sample management systems that you might need to be able to collect your data. And then data collection and processing. So traditional survey data collection methods like mail, web, phone, in-person interviewing too as well. And then, as I mentioned, qualitative data collection, focus groups, in-depth interviews, and medical specimen collection, variety of different other types of data. We're really, like I said, tried to be very inclusive in terms of what we can offer in terms of data collection services. And then processing that information. So data entry, you might need that for your project, maybe scanning some paper forms. So we still, believe it or not, do some things with paper, a fair amount actually with paper these days. And coding data. So maybe you've got lots of text information and you'd like some help with coding that. We have software and experts that can help with that. And then cleaning data, weighting data, all processing steps that happen after the data are collected that we can certainly provide some expertise and support with as well. And then maybe you have a team. As I mentioned, flexibility is a really important part of what we want to be providing to folks. And so maybe you have a team of graduate students. Maybe you have folks already on your team that can carry out the data collection. And you would just like to maybe hire us for a few hours to look at your design, maybe to look at your questionnaire, think about maybe how you're going to process your data on the back end, maybe think about how to develop a really good recruitment strategy. Those are all things that maybe you just like to hire us for a few hours to be a consultant on a project. We're completely fine with that too as well. We don't need to be the person necessarily collecting the data if you have that expertise already in your team. So we want to be really flexible on providing whatever support is going to be most valuable to your research. And we can also provide a custom training to your team. So maybe, for example, you want some students to do interviewing for you. We can provide them with some good state-of-the-art training on standardized interviewing techniques as one example of an area of custom training that we do. All right, I think I'll just stop here for a minute and see if there are any questions before I go into delving into each of these areas in more detail. Any general questions at this point? Great, a question. Are these services free? Now, that is a great question. We do provide some limited consultation for free. And I'll be addressing that later on. So we do have some regular consultation time that we're happy to provide free for folks. And if those times don't work for you, we have weekly consulting hours. We're happy to find another time. And we're usually able to give folks between 2 and 4 hours of free consultation. The rest of our services at this time are fee for service because we are paid all by our projects. We don't receive funding through the university to support the work that we do. So we have to be funded completely based on our projects. So if you have something that's of interest where you see a service that you might like to partner with us on, we'd be happy to prepare an estimate for you and work with you on the potential cost for that. I mean, like I said, if you're just looking maybe for some limited consultation, we can do that for free. Thank you for that question. All right, we'll go forward. So I'll start first with the research design and development, delving a little bit more into those services. So as I mentioned, we can work with you on applying best practices in the research design. So thinking about the overall design you're going to do for a particular project, what might be the best way to collect that data? Are surveys the best way to collect the data? Do you need qualitative research? Do you need both? Also, maybe what's the best design even within a survey protocol? So this is an example from one of our studies a couple of years ago that just outlines the protocol. And I definitely am not going to go through and make you look at each of these specific information that you see in this chart. But just to give you a sense of some of the things that we think about and that we're going to work with you to apply the best survey science for, and also try to use your funding as cost effectively as possible to get the best quality data. So things like, how many contacts do you need? Should you be using a mail approach? Should you be what we call pushing people to web? So sending them something and asking them to go online, pushing them to use an online method to input their information. What kind of postage do you want to use? What's going to be the best postage for you given your cost constraints and your project goals? What kind of an incentive might be good to reach people? So all of these are things that we'll work with you on and help develop something that looks like this to provide a really rigorous design that you can include in a proposal, or if you've already gotten the funding, what's going to be the best way to collect that information that's going to meet your particular project needs. And We can also help with writing this up as part of a method section. So for your proposal too, as well, potentially thinking about writing something like this, giving you some good citations for why this would be an optimal approach to collect the data this way. That's something that we're happy to help you with. So if you're thinking about something at the kind of the grant development stage, certainly reach out to us. We'd love to talk with you about thinking about the design at this point. And then also sometimes people will come to us certainly after they have the funding, and we're happy again to work with you on developing what's going to be the best way to use those funds cost effectively and get you the most rigorous data collection. We can also help with programming and instrument development. As part of this, in questionnaire review, thinking about doing an expert review of your survey. So we have methodologists who are trained in understanding how people interpret questions, answer questions, what are potential sources of measurement error and how people might be answering. So maybe people are going to have a hard time comprehending some of the words that you're using in your question. Maybe people are going to have a hard time remembering the information that you're asking for. So those are all things that our experts are trained to look for. Maybe your wording isn't presented in a way that's unbiased. Maybe you haven't put an exclusive list of response options. There's a lot of considerations that we look at as methodological experts to help strengthen your questionnaire. So our goal is really to ensure that you're getting measures that are valid and reliable. And so we can do a review of your survey, give you the information in a written form, meet with you about it, kind of help you work with iterations of strengthening the measures across different versions, whatever it takes to kind of help get you to a point where the instrument is strong and methodologically rigorous. As part of this, sometimes projects have the capacity to conduct what are called cognitive interviews. So this isn't like a cognitive assessment, where we do those as well too, where we're assessing sort of the level of cognitive decline in folks, particularly older folks in some of the projects that we do. But this is actually a technique where we're trying to understand cognitively how people are thinking about the survey questions. So they're one-on-one interviews. We ask the respondent to think aloud as they're coming up with their answer. We also ask some probes after the respondent might tell us what they're thinking aloud, but it's really, I kind of think of it as almost like a brain dump. So we really want to understand, how is the respondent interpreting our questions? And we always learn something about the questions that we didn't anticipate. So something that we thought was clear isn't so clear when we actually ask people to provide us with some information about what they're thinking about. So just to give you a kind of a more concrete example here. So for example, this was from a project that we were looking at recently that asked people some information about participating in testing or not cognitive testing, clinical testing. So the question I just read you used the word invasive. What does the word invasive mean to you as used in this question? So here we're trying to understand, does the respondent understand the word invasive the way that we think they should? Based on our interpretation of how we're wanting to use this question. So again, it just really gives us an in-depth sense of how people are understanding the question. It's very meta, right? We're kind of asking questions about the questions, but it gives you a good sense of maybe areas you might need to clarify or areas that you might need to use terminology in a slightly different way for people. And then a similar kind of example. So question 3 tries to describe what a PET scan is. It says the PET scan is similar to an MRI, but involves getting an IV with a dye to look at certain proteins in the brain. How would you phrase this question in your own words? Again, just another probe that we would do as part of this cognitive interview to understand how people are interpreting the question. It just gives us rich information, and we might want to rephrase the question in a way that they're going to understand it. Really valuable technique. As you can imagine, it's not for every project because it does take time and funds to be able to do it. But even just a few interviews, we always learn something from this. And projects that have a little bit more resources, we might do this in rounds. So we might actually do a few cognitive interviews, then modify the questionnaire, then do a few more to get to a stage where we're really comfortable with the quality of survey measurement. It's, like I said, really invaluable. We always learn something from applying this technique. And then we can also support survey and interface programming. So as I mentioned, we have a really great IT team that can program surveys in REDCap or Qualtrics, or even we have a custom in-house software too as well that we've developed to do survey programming. And then also, as I mentioned, interfaces. So potentially even something that's not a survey, but something that requires someone to go online and interact with an interface is something we also bring expertise into as well. Another part of the kind of initial research design phase is sampling design and recruitment. And so again, there can be different ways that we can support that depending on a particular project's needs. We have good relationships with a number of vendors that can provide us samples of people. So if you're looking in your research to get access to people in the general population, or maybe you're looking for businesses or doctors, lots of different types of populations, we have relationships with a number of vendors and can help you kind of evaluate the different samples that are out there. As you can imagine, and may have experienced yourself, you can get data really cheaply, but there's going to be limitations with that. And then what's the value of potentially using a more expensive sample source? And the comparing and contrasting some of the limitations there. So that's something that, as I mentioned, we have some longstanding relationships with good vendors and can work with you on evaluating those so that you know that the sample that you're getting from a vendor. We also, if you're maybe have access to a list, so maybe you have a list of patients, you have a list of providers, you have a list of organizations, lots of different types of samples, list of people receiving some particular services. We can certainly implement a random sample design for you. For example, a stratified design where we ensure that we're getting representative samples from different groups of the population. Lots of different ways you can think about drawing random samples that we can bring the expertise to help support that if you have an existing list that you're already using. All right, I think I'll stop there. That's kind of the initial research design and initial steps of the process in research. Anybody have any questions or comments on that section before I go into the data collection part? All right, I will go forward. So as I mentioned, a variety of different types of data collection that we're engaged in and really pride ourselves on trying to be flexible, as flexible as we can be. And if we don't know a particular area or haven't done it before, we welcome the opportunity to try to develop capacity that will meet your needs as well. So we've certainly, as I mentioned, started out as really doing phone surveys, but have moved on to using a variety of different data collection techniques and developed a lot of expertise in these over the years. So any type of survey, I mentioned mail, web, phone, in-person, focus groups, qualitative interviews, direct observation. So really any and all kind of survey or qualitative data collection is something that we're happy to work with you on, collecting that type of data for you. I mentioned a little bit cognitive interviews, but we also do cognitive assessments too as well, and have done several with older populations recently, standardized cognitive assessments where our staff is certified to be able to conduct those cognitive assessments with the population. We also have done projects collecting environmental samples. So as I mentioned, dust, tap water, actually a bracelet that folks wear that can measure exposure to environmental contaminants. And I'll show an example project with this later on. So lots of different types of environmental samples that might be used to assess whether folks are exposed to environmental contaminants. And then also medical specimens. So we have phlebotomist staff, so can collect blood samples, saliva, fingernails, urine. Also have folks here you can see in the picture collecting or measuring blood pressure, height, weight, lots of different types of measurements that might be needed for a particular project is also staff that have got experience doing that and can administer it using very standardized and high quality measures. Another set of services is the kind of back end of the data process. So if you've got your data already or we've collected the data for you, thinking about if you need to scan it or enter the form. So depending on the particular project needs, sometimes we're using a scanning service that we've been using for a long time and can scan the forms and ensure that that information is transferred in a quality manner. Other times it makes more sense to do data entry, and we can talk with you about what those different circumstances are. And again, have some strong procedures in place to ensure that those are high quality. So independent double entry, for example, ensures that you've got a good low rate of error in terms of how that information is being entered. We also can do coding. So coding, maybe you have a bunch of text data, you've done interviews and you want to code that into major themes. Maybe you have a coding scheme already, you have a sense of what the themes are going to be. We can work again to implement some good high quality procedures and use some software to help make that process efficient. And also potentially cleaning the data set on the back end. So if that's something that maybe we've collected the data, we'll ensure that you get a clean data set coming back so that you don't have to worry that everything is labeled and all we've examined any inconsistencies in the information. We also provide technical services in weighting. So weighting is used in a number of our general population surveys. So when we're looking, for example, to survey Indiana, residents of Indiana, adult residents in Indiana, We can use census demographics and ensure that our final respondents look like our census population on things like race and ethnicity, on gender identification. So kind of helping to correct for some of the problems that we know, because certain types of people are more likely to participate in surveys and qualitative research. We can try to help remedy some of that by adjusting our final sample to look like the demographics of the census. So there's a number of technical considerations, statistical technical considerations that come into doing that we can bring the expertise for a project to do that. So as one question earlier about sort of what might be available in terms of free services. So we do provide consultation for up to 2 to 4 hours for free and are happy to do that. So again, people come to us and they may have a draft questionnaire or a draft set of questions that they're asking for a focus group guide, something like that. We'd be happy to take a look at that and provide some feedback to you. Maybe you're thinking about, I've got my research questions, what might be the best way to collect this data? How might I be able to get in touch with people to participate in my study? How might I write a good recruitment message? All of those are things that certainly people come to us in the consultation hours with that we're happy to help provide some feedback on. So certainly if those are things that are relevant to your research, happy to provide that. And I'll give some information at the end of the presentation on where you can find those services. We have them weekly on a couple of places on the Bloomington campus, but we can also use that time to meet with you by Zoom. And if those times don't work, we're happy to meet to have a different time that will work for your schedule, meet with you by Zoom. And as I mentioned, we're also very happy to, if you've got a lot of capacity maybe in your own staff, but would like a consultant to ensure that you've got a rigorous methodology design as part of your project, we're happy to be a consultant on that or provide a few hours as part of your project. And so sometimes, like I said, people may have that infrastructure already, but they would just like a consultant to ensure that they're applying the best methodology, or ensuring that we're providing some help on specific tasks maybe that you don't have on your research team. We want to be really flexible, and we'll work with you on what you need to help bolster and make that design as rigorous as possible. We also offer some workshops and trainings. So, and definitely we'll point out a few of those here. So we can do some customized training. An example of that we did recently was a few years ago was a retreat for the School of Dentistry. So just again, kind of a few hours of providing some information of things to think about if faculty there were doing some survey research, and we're really happy to tailor this to particular needs of your organization or your team. We've done them before too that focus on particular topics. So maybe you would like to have a training on how to administer interviews or on how to evaluate survey questions. Those are all things that we can provide tailored training for. Maybe how to use Qualtrics. So Qualtrics is one of the software programs we use to program surveys. Maybe you're going to have your team learn that. We'd be happy to work with you on a training for that too as well. So really, want to customize it to the particular needs that you might have. Or maybe you want one that's generic to surveys, and we can do that too as well, as we did here for the School of Dentistry. We also offer seminars as part of the IU Workshop and Methods, which is located on the Bloomington campus, but have also been offering their seminars via Zoom. And they provide some really interesting and rich topic coverage across a lot of different methodological areas. So a few years ago, we offered one in best practices in designing and conducting research studies. And this was a 3-part series, and it covered one session on how to design web surveys, one on kind of what we call the total survey error paradigm in survey research. So where we actually covered a lot of different sources of error you might need to think about when you're conducting a survey. And then one on questionnaire development or questionnaire design. So that 3-part series kind of hopefully gave people a little bit of a toolkit to evaluate their own research and potentially strengthen it. And so possibly that we might end up doing those in the future. And you can also go to their website and find some of the materials from that too as well, if you're interested in kind of revisiting what we might have covered in that. And like I said, we'll likely maybe repeat that in the future. But certainly encourage you to look at the workshop and methods. They provide a lot of really nice training across a variety of different aspects of methodological design. Okay, I wanted to highlight just a couple of funding opportunities. So if you might be interested in thinking of ways that you might be able to fund working with us, there are a couple of opportunities, and you may have been familiar with at least maybe the first one. the CTSI Core Pilot Grant Program. Since we are CTSI Core, then certainly encourage you to think about that. And we've been on several applications for those Core Pilot funds. So a little bit of a link here that you can go to, and I'm sure Joel on this call too as well. Joel could provide you some more information too as well if this is something you might be interested in. So encourage you to reach out to us and talk about how we might be able to help support your pilot data collection on a project. We also have a award that's made possible through funding through IU's research office. That's called our Research Methods Collaboration Award. And so I'll explain a little bit more about that, and also to there's a link here to look at that as well. And I could put these links too in the chat later on. So this is an award that is really designed to achieve 3 objectives. So help folks improve the quality of methods on their particular project, maybe help supplement the resources that you have available for your project. So maybe you didn't have this funding built into your project, but you know you could really use some help with strengthening the methods. And then maybe also you're looking to do a small pilot study and you want to, again, kind of test out what our expertise might be able to bring to your particular project before you ascribe us for a larger study. Those are all kind of good reasons why you might think about using this award to get the opportunity to get some expertise from us on your study. It's open to all IU faculty, up to $5,000, and it covers the time for us to work with you. So as I mentioned, it's kind of really designed to help us bolster the research methods on a particular project and allows you to be able to have some resources, funding resources to be able to support our collaboration. And hopefully we'll give you a good sense of what would be the value of having someone like us on your team. What can we bring that will help strengthen the quality of what you're doing? The applications are accepted on a rolling basis, so there is no particular timeline. You can feel free to submit anytime, and we have a 1-month turnaround. The review is done by the center director, that would be me, and the research office social science leadership also reviews it as well. So a really great vehicle. We really encourage you to think about this as a way to potentially get some support from us, be able to fund getting some support for us and seeing what we might be able to contribute to your team. I wanted to just give you an example. It's really broad what we, really across a variety of different substantive areas and across a variety of different types of topics. So I wanted to give you an example here from a School of Medicine, School of Law, looking at FDA approved apps, also concussion from the School of Public Health. So a really strong variety of types of projects that people are doing. Like I said, we're really open to whatever area you might be in. Just again, trying to think about, are there ways that we can contribute to help you design a questionnaire, help you design the protocol, help you implement some data collection that you might be doing, whatever we can do with that kind of $5,000 that's going to be a benefit to you to help strengthen the quality of the work that you're doing. All right, I think I'll do a little recap here, but before doing that, just wanted to stop and give the opportunity. If anyone has any questions, feel free to put it in the chat, or feel free to unmute yourself if there's anything so far that I can clarify, or if you have questions or comments, would welcome that.
Yeah, I'm curious as to those pilot funds. Do they support all kinds of research, or is it strictly survey research?
Any kind of
biomedical.
Yes, any kind of research, Armando, where you could see a role that we could help contribute to would be completely fine. Yeah, anything that is aligned to any of our services would be completely fine. It doesn't have to be specific to a survey.
Okay, cool. Thank you.
Yeah, sure. All right, I will go ahead then and do a little bit of a recap. So just to kind of give you an overview again of the different areas we've talked about. Being a professional survey organization, we can help you with overall design, questionnaire development, testing, sampling, IT infrastructure, collecting data through a variety of different methods, and then cleaning that data, coding that information, any and all of these things. So really, hopefully I'll give you a flavor a little bit later on some of our projects, but on some studies, we're involved from the beginning to the end of these different steps. Other cases, we might just be doing one of these areas. Other time, we might just be consulting with you throughout this particular throughout your particular project on all of these different areas. So we're really happy to be flexible and making sure that we're helping to serve your team in the best way possible. So really want to be serving your needs in whatever format that might be. And our goal is to really ensure that we're applying the science of survey methodology. So that is what our team is trained on, and consistently ensuring that we're keeping up with the latest in survey methodology and research methodology more broadly. And also bringing our operational expertise, as I mentioned earlier, trying not to have to focus on a lot of the details of getting mailings out, or trying to call people by phone, or having your staff go out and collect medical specimens. All of those are things that we can help kind of relieve the burden of you for that part, so that you can focus on really the science of what you're doing, and can bring many years of experience doing it to help make it really cost efficient and effective for you too. I did not grow up knowing that I wanted to be a survey methodologist, but I do think it's a really amazing field to be in, and really love doing this kind of work. Our team, we all really love the capacity to be able to bring this expertise on projects, and hope that it really brings kind of a unique perspective to your study, and hopefully you get a chance to kind of see what that is like. So here, I won't go through each of these. I don't want to kind of, make your lunch be sort of droned in here in a variety of error sources, or come away on a Friday feeling like we have a lot of error in the work that we do. We don't have a lot of error necessarily, but we do have a lot of error sources that, as a methodologist, my job is to worry about helping you minimize those on your project. So this is a common paradigm that you'll see among survey methodologists. And so our goal really is, and what I'll be contributing, or what one of our staff members here would be contributing, is thinking of ways to design your protocol and implement your study so that we're reducing these errors. So can we reduce non-response error by trying to give as many people as possible a good chance to participate in the study? Can we use incentives? How many follow-ups? What ways should we follow up with people? All of those are good ways that are research-based from our survey science literature to help reduce non-response error. Can we look at the people who've responded? Do they look like the population that you're trying to get data from? All of these are, again, analyses that we can help with, and considerations that we're always thinking about when we're working with you on a protocol. Similarly, on the kind of left-hand side, measurement error. So are there ways that we can use, as I mentioned earlier, cognitive interviews, us reviewing the survey from our methodological perspective, pilot data collection? How can we use all of those different techniques that we know will help us really develop good, strong, valid, reliable measurements? Again, we can bring that expertise. We'll rely on your substantive expertise, but hopefully can bring this perspective of you're really thinking through the methodology in a strong and rigorous way that aligns to survey science, to help strengthen what you're producing, not only maybe for a grant submission, but in implementing the study too as well. All right, I wanted to just give here a few examples of studies. And as I mentioned, hopefully throughout you've gotten the theme of, we're really open to doing new things. Said we've started out kind of doing one thing, and now do such a variety of different tasks for folks, and want to continue to grow and ensure that we're meeting the needs of faculty researchers as those continue to change over time. And as I said, being very flexible about, if you've got a particular need, just reach out to us. We certainly are willing to talk with you about things that maybe I didn't even cover here today. So we want to be very responsive to your particular needs. All right. We have a really highly experienced field research team that can collect a variety of different types of data. This has been a really exciting development in past several years for our center. Some of you may have heard of this study or seen it. It was part of IU's Grand Challenge, Precision Health Initiative Grand Challenge. It was called the Person-to-Person Health Interview Study. Actually, I shouldn't say was. It does continue on today. The cohort that was recruited continues to be studied for a variety of different new studies. As part of the initial study for this project, we conducted over 2,600 interviews across Indiana. It was a 2.5-hour in-person interview, so a long time to be spending in folks' homes across the state, collecting a variety of different social science data on people's interactions with social networks, their demographic characteristics, health behaviors, health history, family history, lots of different data to help kind of understand how all of those potential social and physical characteristics interact with people's health. And also included a standardized mental health assessment that was completed by the respondent, physical measurements. So you may have seen the slide earlier that I presented that showed one of our team members getting interviewed at the Indiana Memorial Union, our student union here at IU, as a kind of sample case, getting their height measured, weight measured, blood pressure, all of those things were also part of this study, as well as a saliva sample. Also had the interviewer take some photos of respondents too as well, who were willing to do that. and also a couple of long narrative questions too as well that have been coded. So lots of really rich data that allows us to be able to look at this, and then ultimately linking this data to electronic health records over time that will help us sort of see what happens to people and linking that to these different measures that we collected through the interview. So a really rich and rigorous data set that was collected as part of this. And I should say the 2,600 interviews were done with a random sample across Indiana. So that again also lends a lot of rigor to the design. And as I mentioned, kind of a specialized capacity for specimen collection, both medical specimens and environmental samples. We did a project, as you can imagine, maybe certainly challenging in assisted living facilities during the pandemic, trying to recruit assisted living facilities to help us with a project to see about exposures to environmental contaminants in these particular types of settings. And for this one, if you kind of see this sort of silver object there up at the top, was a air quality monitor that we left in part of the residence at the assisted living facility to see what kind of exposure there was. We also had our interviewers sent out with vacuum cleaners to vacuum up some dust that was later analyzed. And then both people that were participants in the study as well as employees at the facility wore this bracelet there, the round kind of black thing that you see there on the kind of bottom left of that set of figures we're looking at now. So that also measured environmental exposure for both the participants who were living at the facility as well as the employees that were part of the project. And then also collected fingernail samples, urine and blood, as well as a short questionnaire too. So respondents also were administered a set of survey questions as part of the data collection too as well. So again, a really rich set of data to look at and see about environmental exposures in assisted living facilities. And thankfully, we got a couple of them to participate during the pandemic, which was certainly a challenging part of this project too as well, in addition to the collection of the specimens. We also have a longstanding research lab. So phone surveying is what we did at the very beginning of the center in the early 1980s. And we continue to do this, but in a different way. We now have our remote research lab. So we have a couple of our staff that are like coming into the lab in person, but most of us or most of our staff now are remote. It also gives us greater flexibility to hire people throughout the United States, which is really excellent. So again, kind of a remote research lab collecting telephone data, and a number of telephone projects that we've done over the years, many, quite a number of them over the many years of our history. But just to give you a couple of examples, so more recent examples, a randomized control trial looking at potential colorectal cancer screening interventions that might help increase this among low-income and minority patients. And so this involved several interviews that you can see kind of here along with the ringing telephone, old school telephone that you see there at the bottom right. So our interviewers were calling them at multiple times to gauge in adherence to the intervention, as well as a variety of different questions that were part of the protocol too as well. And then also for a number of our studies, even though we might not always collect the data by phone, we do what we call nudge calls or follow-up calls. We did this for a study of pharmacists, asking them to then complete the survey using a different method like a web or a mail survey. So just in kind of following up and prompting people. As I mentioned, our goal is often to reduce non-response error. We want to make sure that we're maximizing the number of people participating, as well as ensuring we're getting a diverse set of people participating. And so we do these follow-up calls from our remote phone lab to help encourage people to participate in the survey. Maybe if we've sent them out a mail survey, or we've sent them a web survey as well. We also have a wonderful partnership with WISE, part of CTSI, to help us do. They've been a wonderful partner to help kind of facilitate us connecting with the state's Family and Social Services Administration to do some phone surveys for them. They're oftentimes looking at surveys of folks that are receiving their waivers. So for example, the aged and disabled waiver population. So administering the Consumer Assessment of Health Plan survey, or CAP surveys, to assess the quality of services being provided to folks that receive the aged and disabled waiver. We also did a study last year for them looking at informal or unpaid caregivers throughout the state to help the state continue to support them in providing help to folks that are 55 and older. So we wanted to kind of understand what needs they have, what additional support do informal caregivers need throughout Indiana, and also potentially what are the negative effects on their physical and mental health from being informal caregivers too as well. So So this has been a really wonderful partnership made possible through the CTSI to work with WISE, which does amazing work and have been able to kind of facilitate some connections for us working with the state. And this has been pretty much all telephone work. So again, using our remote telephone lab. We also do mail and push to web methods. So these are, interestingly, in today's age, we do a fair amount of mail work still, sending folks surveys through the mail, oftentimes involving sending them a little cash and then sending a paper survey sometimes, or as I mentioned earlier, a push to web. So where we might send people a link to a survey through a mailed letter. And sometimes a postcard like you see here on the left. So this was from our Hoosier Health survey that involved a mail survey. So lots of different types of surveys that are general population, where we're trying to reach a variety of different groups in the Indiana population or broader population to be able to participate in a survey. We oftentimes use a random sample of addresses that's made possible through the United States Postal Service. And so we use these kind of push to web methods where we initially send them a letter and ask them to go online to complete the survey. And then in order to ensure that we're not just only representing people that are online, we send them a paper survey later on for folks that maybe don't have regular or good access to the internet, or maybe just don't feel comfortable completing a survey that way. So usually we use these kind of mail and push to web together to ensure that we're getting a good, accurate sample coming back from the project. So again, have a kind of a good relationships with mail vendors, can also do mail surveys in-house ourselves. So lots of ways that we can help make that a little bit easier for you if you're doing something that's got a mail or push to web component. So I mentioned a wonderful IT team that really makes a lot of really interesting projects possible for us. And as mentioned, they do REDCap, Qualtrics, custom programming that you might need, important considerations for storing the data, managing the information, complex web-based interfaces and surveys. So again, we've been, since the 90s, really doing a lot of this work that's really helped kind of push us at the forefront of developing web-based interfaces and surveys. We also do a lot of emailing. So we actually send out millions during the year, millions of emails across our projects. So have invested in a mass email software that allows us to create really nice customized messages and allows for good tracking of that information too as well. So information coming back to help ensure that we're able to really do an efficient and effective job of sending out emails. So interestingly, some projects actually only maybe have the need to send out an email. They maybe already have the capability to administer the surveys themselves, but they know that we bring this capacity of being able to do a really good job with mass emails. So some projects have actually hired us just to do this one task itself. So certainly the IT capacity is something that if that's something of use to you, we're happy to talk with you about that. And then also have a number of projects that require storing and carefully considering PHI. So we have good, strong protocols in place for doing that too as well, if that's going to be a particular consideration for your project. An example project, and when it's mentioned earlier, sampling and weighting are also technical areas of expertise that we bring. And so this is a project that we do with public health researchers looking at adult gambling, prevalence of adult gambling, and awareness of potential services to support potential problem gambling in Indiana. And so we work with the team here that has the capacity. They carry out actually everything except for the sampling and the weighting part, which is what our role is on this project. So here we're looking to help give them a good representative sample of the state. So we work with a vendor to give us and work with them on the design to obtain a good address-based sample of households in Indiana. And then once they go and they collect the data, so they handle all of the mailing and the data collection, they bring the data set back to us and we weight the survey for them so that it, again, is representative of the population in Indiana. So as I mentioned before, unfortunately, in surveys, we tend to get certain types of people and overrepresent certain groups and underrepresent other groups that we want to have and ensure that we have in the appropriate proportions to their representation in the population. So we can do some weighting on the back end to help ensure that we've got that the data weighted appropriately. So as I mentioned, kind of here is a good example of a case where they have a lot of the other pieces, data collection pieces available in their own research team, and we're providing this technical sampling and weighting expertise, which we're happy to do. As I mentioned before too, we also do other types of data. So not just surveys, but also qualitative data too as well. So this is a project that we're involved in right now that involves analyzing data from nurses who were serving on ships during the COVID-19 pandemic. And we're helping to work with the team there to use some software called MaxQDA to be able to code responses from interviews that were done with nurses who were on the ships at this time to identify potential challenges that they identified from being on the ship during this time, and possible ways to help improve for the next pandemic, the experiences of Navy nurses serving on ships. So lots of really good, interesting data coming out of the interviews that we're using software, this MaxQDA software, to be able to code that text into particular categories and then kind of identify some of those themes and areas that could be potentially subject to interventions to help improve in the future. I also mentioned at the beginning that we do offer consulting, and we're happy to talk with you if you would like to learn more about our services, or if you'd like to have us take a look at a protocol that you're thinking about developing, have us look at an email message maybe that you're administering as part of your project, any of those things. We're happy to talk with you about sample design, whatever it is that you might need for your project at our free weekly consulting. We have this on 2 places in the Bloomington campus, but as I mentioned, we're happy to do it by Zoom. These hours are during the academic year. If they don't work for you, we're happy to meet with you during different times too as well. So these are just times that are available each week. If it's something that works for your schedule and you would like to do a Zoom call, feel free to reach out to us and we'll be happy to arrange a time to talk with you. All right, I think that is all that I had. Thank you so much for the opportunity to provide you with some information about the work that we do at the center, and I'm happy to answer any questions, or happy to have you unmute if you'd like to convey any questions that you have too as well. Great, so let me answer the questions here. So do you have partnerships with vendors in veterinary medical profession or access to sampling frames representing target populations that are related to veterinary medicine? Great question. I don't know that offhand, but I do know that we have some vendors that I would go to ask that question. So absolutely, we could work with you on potential ways to be able to access that. And longitudinal surveys with follow-ups extending through multiple years, absolutely. So we do a lot of longitudinal surveys that are that involve multiple years. So the survey I mentioned, the person-to-person health interview study that started several years ago, we've been following up with folks each year. A number of our projects have a longitudinal component, so we're certainly happy to talk with you about those designs and work with you on implementing those designs. Definitely feel free to reach out, and I can certainly connect you with possible vendors for the veterinary medical profession. Thank you for that question.
Yeah, another question, Ashley.
Yeah.
So I do biomedical research or clinical research, and so I'm wondering, does this apply to that, like in terms of sample collection? What is that like? How does that fit into clinical research, and is there assistance with, I guess, the process of bringing participants in and collecting biospecimens such as blood or even like breast milk?
Sure. And you mean kind of thinking about recruitment or actually doing the specimen collection, or both of those things?
Yeah, maybe a little bit of both. I'm interested in Latino populations, and I know it's pretty difficult to engage them in the clinical trials, and so I think that there might need some help there, but also just in the regular process of bringing them into the clinical research unit and collecting biospecimens.
Yeah, it's a great question. So absolutely, I think we could certainly talk with you about recruiting participants. So that that's something that either we could help you with or potentially connect you with people to be able to do that. And then certainly for collecting the specimens, that's something that we have staff that are trained to do. So that would certainly be something that we could talk with you about how to make that happen. But yeah, absolutely, we certainly can collect those specimens and have folks that are doing that. We have phlebotomists on staff for blood and certainly any other types of specimens that you'd be looking for. That's definitely something we could assist with. And we just need to figure out the logistics, right, of having them getting to the sites and things like that. But that's something that we can handle for sure on a project. Yeah.
Cool, that's awesome. Is this strictly in Bloomington, or do you guys also work in Indianapolis to do
so yeah, so we actually we work with folks all over. So yeah, it's definitely not limited to Bloomington. Actually, some of our staff live in Missouri, so we're kind of we're kind of all yeah, definitely.
Okay, but in
Well,
terms of
and we're,
bringing participants in, if it was like a clinical research unit setting, is that strictly in Bloomington, or do you guys also have capabilities at the IU campus?
yeah, right. So we would probably need to talk with you about how we would have no problem getting our staff there. We would just need to talk with you about sort of, yeah, setting up how we would get in touch with the clinics
Okay.
and things like that. But yeah, we have staff that interview all over the state. So we don't have a problem recruiting staff in different areas at all. Yep.
Okay, awesome, thank you.
Yeah, thank you.
Thank you, Ashley. It's really very informative, and I think we're happy to highlight the services that your core offers. So thank you for participating.
Thank you. I really appreciate it.
Yeah, because that was a very informative and comprehensive presentation.